What does it feel like to get fillers? That's a hard thing to answer exactly because it's different for all of us. Some of us are very pain sensitive, our skin sensitive, and some of us are not. So I inject patients that say to me, I don't feel anything, and I inject people that they're anxious people and their anxiety leads them to have more discomfort when I inject them. The filler injections hurt. As a general rule, facial injections, even lip injections, if done carefully, do not hurt or do not hurt very much. The discomfort is very low. Now there are certain ways to do this that diminish the discomfort. So here's what I do. I put a topical anesthetic over the area that I'm going to inject. That numbs the skin itself for the skin penetration with the needle or cannula. But actually, a lot of what people feel is the filler penetrating the fat and feeling that. So here's how I do this. All fillers today are mixed with lidocaine, Xylocaine. This is an anesthetic and it's potent. It's what I use to anesthetize for nose jobs and facelifts and very invasive things that I do. And it requires somebody that's really good at doing this. Now realize I said, these are mixed right with a filler. So if I'm doing someone's cheek and I inject a little bit in the cheek and hold the needle or cannula there, they're not feeling anything now. And I wait. And then I go back and I re-inject the area a little more. And as I'm doing it, the area gets numb. It gets anesthetized. So a common tact for me if I'm doing both cheeks is to inject here a little bit. I go to this side, I inject a little bit here, and I wait. Because Xylocaine, in order for it to work, takes someone who's patient. And some injectors are nervous and they can't be patient. So then I go back to the first side, which has had a little bit of time for the Xylocaine to work. And now I inject more. And I inject more on the second side. Now we're numb. If I'm going to do the mid-face and the lips, I do the lips last because they're the most sensitive area. And now some of the anesthetic is drifting down into the lip. And usually people say, I can almost not feel that at all. That's the normal thing. How long will my face or lips hurt after getting fillers? If the person is not too super anxious and not too super sensitive, and the injector is careful and patient, the discomfort during the injection should be very low. And most of my patients are surprised, especially the ones that have come to me for the first time, when they say, I barely felt anything. That's the usual. That is the usual. But there's a second kind of discomfort, and that is what you feel afterwards. How does it feel to you a day later, 2 days later, 4 days later? How long does our face and lips hurt? Our lips generally feel a little swollen, but they don't hurt. The numbing that we have creates enough numbness that usually people's lips don't hurt. But one area that does hurt, it doesn't hurt them when I do it. They don't feel any pain at all, is when I do an injection rhinoplasty, a non-surgical rhinoplasty. I'm injecting the nose. It's not particularly sensitive area, and I can get them almost entirely pain-free when I do inject them. But when I talk to them a week later, they say, yeah, I was sore for 3 or 4 days. Almost the same kind of soreness when you get the vaccine in your arm. But the nose is sore for 3 or 4 days after that. More sore than some other areas. The cheeks are a little sore, a day, day and a half. The nose, 3 or 4 days. And I don't mean sore enough to need pain medicine, just a little sore. Usually a non-steroidal anti-inflammatory ibuprofen is enough, or Tylenol, acetaminophen is enough. It's not bad pain, but they're mildly sore. It's just a little bit of a dull soreness. And the nose is probably the worst for that. The jawline gets it a little bit, but the nose gets it the most. So if you have questions about this and you're needle phobic, I'm the one for you because I'm really gentle with this. And most of my patients tell me basically didn't hurt them at all. So I'd love to inject you, talk to you, consult with you. Come see me, email me, call me. Thanks very much. Have a great day.